Hi, as the chief of the Pediatric Urology Division at the University of Wisconsin, I really want to first thank you for taking the time to visit our website and learn about our program. I do really take pride of being part of the university and the Department of Urology, and I will take the next few minutes to give you a summary of what the Pediatric Urology Division is about and also what the rotation would look like. As you may know, pediatric urology is a subspecialty that deals with common genital and urinary systems anomaly in children. The pediatric urology rotation, in my mind, is a necessary rotation that will expose the residents and even medical students to the different common congenital pathologies, all the way from hydronephrosis of the kidney, even simple circumcision and post-circumcision complications, hypospadias, and even undescended testicles, and a large spectrum of congenital anomalies that we usually care for. I trust that at one point in your lifetime, as a physician, you will hear about one of the different pathologies a pediatric urologist deal with. What's unique about pediatric urology is the fact that this is really a medico-surgical entity like the urology specialty altogether. We run clinics half-half between seeing patients in the clinic and operating. We also have other responsibilities. We do interact with the families, and believe it or not, we care for kids even before they are born. So for instance, we have a large number of patients who are identified to have some congenital anomaly before they are born, and this is where we deliver care to the pregnant woman and the parents who are expecting. We also care for patients who are born with the genital anomalies or hypospadias, undescended testicles, bladder bowel dysfunction, incontinence, and even much more severe congenital anomalies such as spina bifida and differences in sexual development and cloacal anomalies. With the evolution of pediatric urology care, it's actually becoming more and more valuable to go through this rotation and through this training, because we know now is that the pediatric urology, due to the longevity of patients, are now going through what we call as transitional urology care. And I think at one point throughout the rotations, you will see that this subspecialty will metamorphose into a bigger scope specialty. Now, the advances of technology, albeit perinatal ultrasound, really put us in a good position to interact with different disciplines. One of them is the maternal-fetal medicine, and also pediatric surgeons, pediatricians, nephrologists, and even endocrinologists. Well, now, interestingly, and with the privacy surrounding the issue of genital pathology, it's possible that a lot of people do not really know what pediatric urology does, but this is the purpose of this short video. Because genital anomaly, by the way, constitute a major portion of what we do, I think it's very mandatory for people to be cognizant about the fact that it's a private area, and this is why we take privacy very seriously. So between prenatal hydronephrosis and all the different pathologies that we can face before birth all the way up to the age of 2 to 3, we usually care for those children who have genitourinary anomalies. But what is interesting about our subspecialty is that it's a lifetime follow-up. Most of our patients at one point, their pathology may need to either resurface in their care as they become adults, or even in their evaluation later on. For instance, a hypospadias patient will for sure need some evaluation at one point when they go through some elements of bladder prosthetic hypertrophy. And of course, patients who have undescended testicles will most probably need to go through some evaluation at one point if they have any infertility or if they have a higher risk of testicular cancer. So in a way, what I'm trying to tell you is that this is a subspecialty that's unique. It goes through a long range of age groups, but most importantly, aside from being a medical legal subspecialty, it's actually unique in a way because it also provides you with a huge exposure to microsurgical procedures in addition to open and even minimally invasive and robotic or laparoscopic. And that's the uniqueness about this subspecialty. In addition to that, at the American Family and Children's Hospital, the Division of Pediatric Urology is very keen to work closely with different disciplines in the city and in the nation even. We are part of multi-institutional research. We conduct our own research both on the clinical side and on the translational side. And we look forward to seeing you. Thank you.